Americans. And these folks do not have access to the same care that's available in urban and suburban America. Their life expectancy, if they're in a vulnerable situation, is 9 years shorter. Because your zip code actually is your destiny. It determines how long you're going to live, and we can make a dent in this because the high rates of chronic disease and other ailments that plague our rural areas are often driven because they don't have access to care. That's going to change because of the Sentinel legislation. And again, it's similar teams, the same leadership, same president, same Congress that passed the Working Families Tax Cut legislation, which is incredibly popular around the country and will make the great health care plan successful as well. From the day the legislation was signed to create this wonderful fund, this transformational fund, the team at CMS, which is under Secretary Kennedy, began working. And they're here today. Steph Carlton, outstanding Chief of Staff, Alina Chekai, and Emily Chan. That day started working. It was July the 4th, by the way, on the specific vision for the program. How do you actually get the money out the door in 6 months? The president was insistent, did not want the money in Washington. So we began working closely to make sure that we'd use the money not as a Band-Aid, but to empower those closest to the challenges that rural patients face. And who are those people? The 50 people who know rural health care the best? The governors. They wanted the money out of Washington into the governor's hands, and that was done in a remarkable way. The governors thought big. We have one here from Nebraska who was actually the first to start working on community engagement, which is part of that legislation as well. But we have to right-size health care in rural America, and that's an important phrase. All 50 states submitted amazing ideas to transform rural health care in ways that should have been done decades ago. The CMS team awarded each team their portion of the $50 billion investment precisely with the same precision that we took Venezuela leadership, a convicted individual, and with Iran as well, the same precision on time before the end of the year, and got it out of Washington into the states. Now I want to take a step back and do a little thought experiment, Mr. President, if you want to do this. If you, and God forbid this happened, had turned your head the other way in Butler, Pennsylvania, it wouldn't have been an ear injury. Now, I've been to Butler. I'm from Pennsylvania. Butler General Hospital is a good hospital. They don't have neurosurgery there. If you have an injury to the head, you have a golden hour to get cared for. You were taken to Butler General Hospital. Because the injury, thankfully, was not as lethal as it was designed to be, it wasn't a problem. But if you'd had a head injury, you could have had your life saved. But without a neurosurgeon, and there is no neurosurgeon at Butler General Hospital, unfortunately, you wouldn't have an option because Pittsburgh is a far, far ride away. That's the closest metropolitan area where there are lots of neurosurgeons. But with this bill, this legislation rather, this funding of $50 billion, Pennsylvania got its share. And they're going to be able to build telemedicine hookups, even telerobotic surgery that would allow an injured individual in a car accident or any other reason that is a head injury in Butler General and rural hospitals across the country to be able to access the best care our nation has to offer so rural America will not suffer. That's the promise of what this money offers to our nation. It's not just paying the bills, it's not just picking up the pieces, it's actually transforming using technology we have widely available in urban America, the way we save lives in rural America. Each state competed aggressively because for $1 billion, Mr. President, you'll fight pretty hard. And they gave us brilliant ideas that they're talking with each other about. So we're actually creating teams that now across state lines will connect because they're all Americans and they base their advances on several pillars. Secretary Kennedy can talk about MAHA because there's MAHA elements to this as well, but very precisely sustainable access. We asked states, how can we bring top care closer, like in the thought experiment I gave you for Butler General. In Pennsylvania and North Carolina, there are regional spoke models, which and hub and spoke means you've got a big hospital in the city and they adopt or work closely with some rural hospitals to solve the challenges of fragmented care. And that actually works. You share administrative back office work, you group purchase your stuff, you save money, you exchange medical records. Alabama has no OBGYNs in many of their counties. So they're doing something pretty cool. They're actually having robots do ultrasounds on these pregnant moms. So we can actually get those images back to the big center. So we know if the child has a problem and we know if that mother's at risk. We have one of the highest maternal mortality rates in the world, in the country with the best medicine in the world.